today's episode, you're going to hear from a nurse who shares real, unfiltered moments of what happens behind the hospital doors, where crisis, grief, and split-second decisions leave an imprint that most nurses carry for years. Our guest, Karen, spent nearly 40 years in oncology, ICU, and interventional radiology. She stood in rooms where families said their final goodbyes, responded to code blue that demanded every ounce of focus and strength, and she witnessed the kinds of moments that reshaped a person from the inside out. The emotional load that nurses carry doesn't just disappear with time. It shows up in their body as nightmares, migraines, tension, pain, exhaustion, and symptoms that might be mysterious. Before discovering eutaptics, Karen tried countless approaches to find relief and shift the chronic pain, but nothing created real change until she found eutaptics. And that brings us to the man who developed the very system that transformed her life. It is an honor to introduce to you Robert Jean, founder and CEO of Skills to Change Institute, creator of eutaptics and Faster EFT. He is a neuroplastician and behavioral engineer. He is known as the Einstein of the mind. Robert has spent over 4 decades helping people rewrite memories, transform emotional patterns, and create lasting, measurable change. Before we get started, take a second to subscribe to the podcast so that you can stay connected to every episode that we release. Hi, Robert.
Well, that's a really big, nice topic. I'm telling you, this one area, medical area, and nurses and physical pains, when we talk about, when I first started, I was dealing with, number one thing was pain, emotional pain, and come to find out emotional pain always led to physical pain. And the biggest thing that really caught me in the early days, I took a class and they were explaining to us how emotions make the body cry, make the body illnesses. 75 to 90% of all doctors' visits are stress emotional complaints. And of course, we all have jobs. We take jobs, and our jobs will lead us down a path that we're familiar with. And so we have a lot of nurses. And doctors, medical doctors, oncologists, lots of nurses from all across the world. And they come to us sick, physically ill, with chronic fatigue, fibromyalgia, autoimmune diseases, chemical sensitivities. And the real question is why? Now, not just nurses, though. It's not limited to nurses. It's limited to any area in our society and our culture and our businesses when there's a lot of emotional things going on, Because, a nurse and or a doctor or a police officer or a preacher or a minister of some form, they are exposed to extreme things that most people don't get to experience. And if they have no processing skills, those experiences go inside of us. And of course, if you come from a really great, functioning, dysfunctional family, you get a lot of training from that. And from that training, you're going to find what you're familiar with. I work with individuals, in drug rehab, and they come from the military. And they're addicted. They're addicts. And the common theme with these guys is first of all, addiction is driven by trauma. And I want to feel better, right? And then I start looking in their mind and their life and their childhood. A lot of them had a traumatic childhood too. So one rough childhood leads to a rough career, and what you're familiar with, then you just keep picking in alignment. But the bad thing is, the more you experience it, the bigger it gets, and the more stuff your mind expresses through the body. Now, there's a misnomer out there: the body keeps the score, and that's not true. The body expresses the score, but the scorekeeper is your brain. Your brain and the memories in which your brain has captured, organized, and used on you, for you, and to protect you. So it's not unusual for self-help people who are in the helping industry. It doesn't matter what industry, nurses, doctors, policemen, you name it. they're exposed to pretty strong stuff. And if they have no coping skill, it wears them out. So even, this is across the board, whether it's a mother or father too, without working in those industries, they're givers, helpers, and again, they start to wear on them if they have no coping skill. So what I do is I teach people how to have control and how to process the past in a way that it doesn't destroy their future.
Yeah, that's right. You do. And, you said so many things right now that I want to unpack, but there's just so many things that you said. Like, one of the things that really sticks out to me is the nurses, like, choosing the career path. So you have a certain childhood, and you have a certain way that your childhood is gone, like the trauma of childhood, and then you pick certain career paths like nursing based on what you experienced.
Not just nursing, but many others helping
Right.
modalities. A lot. I mean, I know outside of Karen's story, this is not Karen's story, but a lot that I've worked with they were usually the only daughter or the oldest daughter, or they were the one it was all dumped on them, or they become the caretaker, they become the guilted one or the blamed one, and so they try to do whatever. And so some have some really, really tough physical, emotional, and sexual traumas too. But the bad thing is, just like with military and just like with police officers, we're familiar with chaos. We're familiar with doing what we have to do to stay alive. And then you find your career path. And if they never learn how to flatten out the trauma of their childhood, it wears out their bodies. It makes them fat and obese. They could
Right.
be addicted to something, or
Yep.
they become sick. And I threw in also counselors, therapists, and ministers, because a lot of people go into these industries because they need help.
It's true.
Yeah.
Yeah. Yeah. And so for the new listeners that are just tuning in, like maybe they're just hearing you for the first time, Robert has a very different perspective when it comes to trauma, PTSD. Do you want to touch on that a little bit today?
Yeah. If you want to say trauma, now, of course, there's two elements of trauma. There's conscious awareness of trauma, and then the real deal, how trauma works, the mind's point of view. All right. So if you personally have experienced a trauma of any sort, what your brain has done is internalized an external event. So, but when you think about a trauma, it's real. It feels real. It makes you crazy, makes you angry, makes you frustrated, makes you feel like somebody's going to get you, whatever that is. Now, that is a self-protective system that the brain operates from. But if I push this away because your trauma is real, and being afraid, being scared is a normal part of your world, but we push it away, and let's look inside of the brain and how the brain actually internalizes the world. So trauma is not what happened to you. Trauma is how your brain internalized what happened to you. So basically, it's how it's processed that event. All right, so that's one. And so trauma, for me, and understanding from a logical point of view, trauma is an education. And now, what is a trauma? Trauma is an event that is strong. It introduces a world you didn't know existed. It introduced you something you didn't know could happen. And it becomes to the brain an education. So trauma is merely an education. Unlike most trauma therapists out there, we'll push them out of the way, and we'll put them right. Here's a trauma therapist. You have a disorder, right? You have a brain disorder, and of course, it's a wound. It's an internal wound. Both of those are incorrect. It's not a disorder. It's not a wound. Now, if you keep that mindset, you're always going to be messed up. You're always going to be broken. You're always got this wound you're trying to patch and deal with. But I'm going to push that away. Let's go to my system. Events, you can call them traumas, good ones or bad ones. Now, there are good traumas or bad traumas. Good traumas are positive experiences. Bad traumas are not so positive, but to the brain, it is not good nor bad. It is just exposure to the world. So you learn how the world works. Now, from this experience, your brain is going to build coping mechanisms to keep you alive and keep you safe. That's it. Now, You could have 1 second experience, or let's say 2 second experience. It happened within 2 seconds, and all of a sudden you see the world totally different. The world's unsafe, crazy, harmful. They'll go out to get you by 1 second, one event, and all of a sudden your brain quit working, is broken. No,
Exactly.
but from that moment, your brain learns something. The world could be crazy. I could get hurt. Bad things can happen. And so it's going to start creating systems to keep you alive. So that's what trauma really is. Now, you can change, and I work with thousands, I can't, probably millions of memories of traumatic experiences. But you can take a traumatic experience, and I've done it for a long time. Any traumatic experience, you bring it to me, you and I will work on it, and by the time we're done, you know what happened. It's not real anymore. You said, well, it happened, so what? Move on. I'm not guilty. It's just an event. Now let's move this out, and let's go back to you, who's listening, who have traumas, right? When you think about what happened, your brain hijacks your whole system. Heart palpitations, you're sweating, you feel like something bad's going to happen. You just went into a hypnotic state. It's a trance, right? And so what we do is we flatten it out, update it to where you get logical and rational understanding, and then all of a sudden, que sera, sera. There was a young girl I worked with. It's really pretty amazing. I worked with her one time. She had a horrible, extremely intense fear of pigeons. He's like, how can pigeons be traumatic? Well, it was horrific for her. Like she changes in something else. She's walking around like it's the danger war, And within that one session, 2-hour session, and I cleaned it up. I adjusted it because traumas are metaphoric expressions of experiences trying to keep us safe and alive based on ideas. And so if you change the ideas, you change how you represent the memories, all of a sudden behavior happens. So the other day I worked on her and I said, how's the pigeon? She said, people think it's a miracle. So totally changed. She totally changed. And I said, well, why did you do it? One session? It's all gone. Now she's had this for years and years and years and years. Wow. One session. But then she brought me some more experiences to work on. I was like, good job. We'll clean them up too. So again, when I work with people in drug rehab who've been to Afghanistan, they've seen horror. People, they killed people. They saw people killed. They saw the worst horrible stuff. And it's to them in your mind consciously, it's so huge.
Right. Mm-hmm.
He said, I've never talked about this stuff. It's so anxious. I said, listen, I know. Just pick a memory, I'll help you clean it up. First memory, didn't tell me anything about it, and I cleaned it up and then he tells the story, says, well, it seemed like it never happened. I know it happened, but it doesn't seem real anymore. And what happens is these events become states of mind. I'll call them hypnotic states. The brain is trying to keep you safe, but based on an experience, and when it's over, and we update it, it's over. Which also means, like a lot of people who come with severe illnesses, Pott's disease, Hashimoto's, lupus, we got all kinds of autoimmune disease, you name it, And we help solve the riddle by changing the traumas. The body is expressing the score that the mind is holding. You change the memories, you change the scorekeeper, and the body follows the changes you made. So that's what we're dealing with. And, Karen, she came into this system, her friend Gary pointed this way, and she took it on. And I remember Karen, she's a scared little rabbit. I call everybody scared little rabbits. But the Karen that you're about to meet now is not the same person we started with 3 years ago. So, it's amazing. For me, in this work that I do, it's amazing to see people change, really do change. Now, it's not really me that's doing it, though. Karen, she listened to me. She took my courses. She followed the instructions. She followed the path to be a practitioner. And the practitioner training is designed to heal the practitioner. In guys, we're going to teach you how to help other people, but in reality, I set it up to heal the sick ones who come try to find help for others. So it's pretty clever.
Yeah, that was very clever.
Yeah.
Yeah, because there's a big difference between your system and the mainstream and what we're being taught about being broken, and now we have to deal with this and we'll live with it forever. So you live broken. Your system is not that at all. As I watch people going through your system, I see myself. I'm totally different person already. Like completely different, and I'm like halfway through here. But I see these people going through this system and I watch them changing, and they're no longer broken, they're no longer victims, they just live in upper model of the world. And you'll understand what that means if you enroll into level 1. You can change yourself. It's really incredible, the changes and the system that you have here. Would you like to, do you want me to ask you some more questions, Robert, and then go to Karen, or should I introduce Karen and then?
Yeah, whatever you think is good, you can call the shots.
Okay.
Karen, she's just so excited to get started.
So Robert, because nurses are in high pressure environments and they witness all these kinds of traumas, emergencies, critical moments, what is actually happening inside of their brain when they experience prolonged stress?
Yeah, it's a good question. And the problem is there's many types of thinkers and brain processings. Most people, not just nurses, most people in general who are in the helping industries, they learn skills. One of the skills is numb out, check out, not be there in their body. So they're just going to suffer through it, endure it, and then try to push through. Others may do that part-time. It doesn't matter which industry, even though we're talking about nurses today, they all have to have a coping mechanism. They have to have some way to deal with stuff. Now, the bad thing is if they push it away and ignore it and pretend like it's not there, it works its way out. Now, how does it work its way out? It works its way out through illnesses. It works its way out through obesity. It works its way out with anxiety, panic attacks. It could work its way out in drugs, alcohol use, smoking, sexual stuff. I mean, there's all kinds of ways that. Now, I'm not just talking about nurses. I'm talking about every system, every person on the planet. You have to have a coping mechanism. You have to have some way to process information. And if you don't, you're going to reach for or go to whatever your coping skill is. Now, the bad thing about the coping skill you choose, if it doesn't shift the problem, the coping skill becomes a problem in the long run. Mm-hmm. And so that's because again, here it is. What drives, I won't call it addiction. Let me explain what addiction is. The addiction is not the drug. Addiction is not the alcohol. Addiction is not the gambling. It's not the sex. It's not whatever you choose. We always think addiction is that. That's the mind of the addict or the mind of the escapeaholic, I'd call them. The program of addiction is, I feel bad. What must I do to feel good? That's the addiction program. Mm-hmm. Again, now granted, now the cookies make you feel really great, or the chocolate makes you feel really great, and there is a quote unquote a high, but it doesn't solve why.
Right. Mm-hmm.
And so that's the big problem. So addiction really is I'm trying to avoid my feelings, and I'm trying to use anything that I can find to escape. Never solving anything.
Mm-hmm. Right. And can you explain a little bit about the unconscious mind, and because pain would be a metaphoric expression that the body's expressing this. Can you, and some people, they come from this belief system that pain is random. Like, oh, I just have a pain there. Like that it's very random, but it's really not. Can you talk about that?
Well, a pain has a positive intention behind it. Pain is to protect you. Mm-hmm. So pain, again, you wake up in the morning and you have to give a book report tomorrow, or you got to have a meeting tomorrow, and all of a sudden, why do you feel sick? Well, that pain says, I feel uncomfortable, I don't feel safe, let's lay in bed. So pain has a reason. Now, granted, you're walking down the street, you fall down, a bone pops out because it's broken. Now, of course, you're going to have pain. But one person doesn't rehearse, replay, and fantasize and focus on the pain, and the other one does. The one who spends more time thinking about the pain, imagine pain, recalling the pain, takes longer to heal, versus the one who doesn't give much thought and much emotions with it. Now, the emotional environment is toxic and crazy and chaos. The pain takes longer to heal, or for your brain to let it go, right? So this is how the system works. Emotions play the number one role, and your belief system as well. So, yeah, so that's kind of, the brain is just is in control of this. Now, I've worked with a lot of people with weird pains. You know, the guy comes in, his doctor is giving him medication for the pain in his arm that isn't there. He lost his arm in an accident. His arm is still in pain. So he's taking medications for a pain that isn't there to deal with the pain. Now, I call that brain pain. That means, and so how do you know your pain is real? Now, again, all pains are real to those who experience it, but pain is also a programming inside the unconsciousness. And so, and you can think of anybody here, you can think about a time you had an accident or you got hurt, and you go back and remember as if you were there and you feel the pain now. That's brain pain. And so what we do is we change it out. So all I did is I changed his pain in his mind and the accident and the emotion that he felt about it. Now I don't need medication for the pain in the arm that isn't there.
Amazing. You just took years off of his life with all the medication that his liver would have to process.
His liver loves me now.
Yes, it does. Oh, so I am so excited to introduce to you Karen, one of my favorite practitioners to work with. She's a nurse with decades of experience, and now she's a certified eutaptics practitioner who helps people release their trauma that they've been carrying for years. So welcome to the podcast, Karen.
Thank you. Thank you very much for having me. I just want to say that I will never, ever discourage anybody from becoming a nurse. It has been, gosh, how do I describe it? It's been a really, probably the greatest privilege in my life. And it's allowed me to learn so much and care for people in their most vulnerable state. I've worked with some of the most incredible physicians. I've met incredible staff, other healthcare workers. It's given me the opportunity to live and work in other parts of the country. It's been an outstanding. I would never ever discourage anybody from going into the field itself. But at the same time, like a lot of careers, like Robert mentioned, police officer, firefighters, we could go on about that. Anything that requires much heart to be able to do the work, there's wear and tear, whether it be the physical wear and tear, the high stress of the environment, and it shows up until we can't ignore it or it's starting to show in ways, but it gets to the point where you can't ignore it. So with these challenges, I think that something that I would want to share with people that are considering to go into it would be love the profession, honor the work, and pay attention to the patterns that could be showing up, because the body does follow the mind, and you'll even notice that with your patients eventually. And just protect your own well-being and that way you're going to be able to continue to love the profession long term, because if you start having issues yourself, then that's going to interfere with your work. So, learning a really emotional coping skill like eutaptics is the way to go as far as I'm concerned.
Oh, yeah. I mean, if you think about it logically, if you have no emotional coping skills, the job, people say, I love the people, but I hate my job, Mm-hmm. And having an emotional coping skill to deal with the tough times fade off quickly and the good times stay longer, and again, that's with any job, whether it doesn't matter what job you have. If your job is triggering your emotions, triggering your frustrations, that's what's going to wear you out. And so having this great skill, eutaptics, being able to not take it personal, not let it bother you, you'll be happier, you'll be more productive, and you'll live longer, and your body will love you more. you know? So a lot of times people say, well, I just need to love myself more. And I said, well, how do you do that? Take a vacation, hot bath, what is it? And I said, the best way to love yourself is to know yourself. What are you doing inside there? If you have unpleasant memories, you have things that eat away and scare you and control you, learn how to change that. That's loving yourself. I mean, Karen, she cared for people because she cared for people. She did it because she loved to help people, right?
Right. But at the same time, we were also conditioned in the beginning stages of learning to sacrifice ourselves.
Yeah, you're last.
Mm-hmm.
Yeah. And that's where the problem is, really. Yeah. So tell us a little bit more about, tell us your nursing career. How was that? I mean, I know, now again, like you said, it doesn't matter what field you go in, guys. There's good stuff and there's bad stuff, Like, when we talk about something that's not so good in eutaptics, which is what I do, there's some facts. There's some things not perfect, but it doesn't throw the baby out with the bathwater. So it's just a part of the learning. But we also see that, I think Karen earlier said that in the early days, they didn't have nurse care, you just had to tough it up. Karen, what was it that inspired you to become a nurse? Why would you want to be a nurse?
Well, initially I thought it was because my dad used to tell me I wouldn't have to worry about a job, and which is true, right? But it wasn't until I started doing a little bit more work through eutaptics and getting the sessions on myself that I made this connection, because from 5 years old to again at 12 years old, my mother was sick. And so I knew that she was sick at 5 years old, but then supposedly she went into remission, came out of remission, and then she passed when I was 12. So that meant me spending a lot of time in the hospital, not a lot of comfortable time, but I think that is the main reason why I became a nurse, was because experiencing that as a child, maybe thinking I could help other people, but that's basically where it all started.
So it kind of created like a love connection too. And
Yeah.
and a purpose and a role in life as well at 5.
Yes, and of course it may have also been the beginning of me swallowing my emotions. And they didn't communicate to you back then. They didn't have a handbook to tell you how to deal with their dying wife, let alone how do you deal with communicate with the children about it, how do you prepare them for something. But that's probably where my nervous system started learning these patterns, which proceeded for decades, I'm assuming.
Yeah. So when you say learning patterns, what patterns exactly are you referring to?
So like you mentioned before, how our subconscious captures something. So maybe for me, it would have been like being in control was like a safe thing, or not expressing my emotions for whatever reason became a pattern, because as you know, through doing sessions with me, you and I one-on-one, that I keep everything behind the white wall. So I think that could have been where that program started, that you don't talk about your issues, you just leave it and deal with it another time.
Yeah, and that's a good point that you brought up too. And just kind of help people understand, there's I call it the fairyland world. They paint a pretty picture, but all the stuff is right behind the picture. And so what they do is they cope with it, but the way they cope with it is they just don't look at it. They put it behind the picture on the wall, and so they just don't deal with it. But the bad thing is, your unconscious knows it's there. Consciously, we don't want to look at it. We avoid it like the plague, But like Karen will tell you, over time, all these years of stockpiling these unpleasant experiences start to work through her body, or work through her relationships, or work through illnesses, or work through whatever the problem is, financial problems, health problems, you name it. So again, this is a great coping skill. By the way, nothing wrong with it except one thing. It's still in there. And so, what we do is we clean up. So, so you learn how to ignore and push through. Yeah.
Yeah,
Very
and then it continued from there into nursing school, and then I was a brand new nursing student with a nursing assignment. First day on the floor, on the oncology floor, walked into the room where my initial patient was at a meeting, and I realized that room 155 was the last room that I saw my mother in.
good.
So again, push it down. Got to look after the patient. Can't tell your nursing instructor you're having this issue here. Just keep going.
Mm-hmm.
And that probably equaled strength to me too, not breaking.
So Ken, you've probably seen some pretty bizarre, pretty rough things in hospitals, haven't you?
Yes, a lot of interesting experiences, to say the least.
Yeah. Yeah, I know we did an interview with Phyllis McDonald, who is also a nurse, and the things that she shared, like, a baby would die and they couldn't put her in the morgue, so she carried this baby with her for hours until there was even available space. So there's a lot of things that they witness and experience that most people would never, ever know, and the impact is pretty strong,
I was still a new nurse, 12-hour shift, 4-bed ward like they have in Canada. I was assigned to one of the patients in that room and probably half a dozen other patients throughout the floor, and in a 12-hour shift. And because it was oncology, a lot of patients were do not resuscitate. So if they pass, they pass, and not any, CPR or anything like that done. And the patient expired probably before about 11 o'clock that night. And then I get a new patient admission from the emergency room. And before the shift was over, that patient expired as well. Mm-hmm. So that's new nurse, probably 22 years old. And like when you're experiencing that at that age, and then you continue on for another, almost 40 years.
But I find it kind of interesting too. Your first child, well, your imprints as being a 5-year-old carrying, with a sick mother, and 12 taking care of your mother, and she dies. You choose a career of oncology, which guess what happens? People die a lot. Mm-hmm. And your first room is the same last room you saw your mother alive in.
Yeah.
And it's kind of bizarre how the brain does that, isn't it?
Yes, keeping me right there in it all, isn't it?
It cuts to reminds me. There was a lady I worked on. I was in drug rehab, and she worked as a MT, and because I have people when we do sessions, Karen's a practitioner as well, and usually have them give me a list of all the traumas in their life, And so her traumas are, she was a heroin addict, right? And she was there at 9/11, traumas, right? Her mother had cancer and she gave a little extra morphine and she died, trauma. She did heroin and her boyfriend doesn't do drugs and he comes and he's pissed off. What the hell with you and this heroin? So he takes a whiff of it and it kills him right there in front of her. And then the last memory, which is the very first memory, she says, I don't know why I wrote it on there. It doesn't have any emotions with it. And it was when she was like 6 years old, 5 years old, 7 years old, something like that. And her grandfather was in the house, at home, in his little hospital bed, and he's reading a book to her. And she says, will you go get some milk for me? So she goes to the kitchen, comes back, and he's dead. And she ran from the house, and she never stopped running until we worked on those memories and changed those. So it's kind of weird how our brain recycles these patterns, or we call them imprints. But yeah. So your brain is just recycling.
Mm-hmm. Participating in letting somebody die. Mm-hmm. Taking them off the ventilator. Mm-hmm. Giving them medication to keep them more comfortable. Right. Communicating, people that have ended up on ventilators that have been there for a long time, or people that ended up on a ventilator coming through the emergency room, and there's just the quality of care isn't going to be there if they survive. So there's been a lot of that, and there's a lot of people that don't realize that actually happens in the hospital. And of course, it's the patient's right, but just experiencing that and feeling like you're being a part of it. Mm-hmm. Family members, dealing with family members, even as a new nurse turning on the oncology ward, turning patients, and they have pathological fractures right underneath your hands, just because, you know, they're cancer. Making friendships with patients and losing them, developing long-term relationships because they've been in the ICU for a number of years. I had one patient again when I was a new nurse. I guess I could say his name, but his first name was Allison. He had leukemia, and he finally got a weekend to go home, but he didn't come back.
Yeah.
So, you know.
I mean, all of these things emotionally affect you too, don't they? Back then.
Yes, emotionally. Like nowadays, I believe they have help at hospitals for nurses that go through different things like this. But it's even thinking about it now, it is just so bizarre that we are programmed to sacrifice like this. That it's just, you have a patient die in the middle of your shift, and you got to go back and look after your other patient, and maybe even get another patient from the emergency room to fill that room. There's no time to even breathe or come up for air.
Mm-hmm. And I think that plays a big role why nurses have a lot of health issues, a lot of illnesses after they come, or while they're in there. I mean, I hear nurses about having to hold a child down to give a shot, but it was so traumatic for them to even do that, you know. So it's a tough emotional world. And again, if you're a nurse, you know, we want to tuck it away and not ever think about it, but it's inside of us until you know how to change it. You know, it's pretty not so easy. You know, even like a guy who was he's helping someone with a flat, and he was helping a practitioner. And he said, "What do you do?" I said, "Well, we help neurologically change bad memories." He said, "Even memories if you smell the burning flesh?" He said, "Of course." So it is. I mean, he's helping people. He's a fireman, but this burn a trauma in his mind, and so within not even 5 minutes, it's gone. She goes, "Who are you? How do you do that?" You know, it's like really fast because it's neurological information, but it impacts our decisions. You know, and of course, as a child growing up, if you come from a very emotionally toxic world, that world programs us. And we see the world from our unique angle of pain and hurt. And so again, yeah, a lot of people not, and a lot of people maybe not, and maybe that's why a lot of nurses, you know, like what was the statistics there, Crystal, about nurses in general? You have a lot of statistics.
Yes, I do. I have some statistics here. So 18% of nurses will struggle with substance abuse, and that's what we know of, right? 31% overweight, 18% obese, which means 49% have weight issues. So this is Canadian statistics. So registered nurses, 75% responding nurses reported being burnt out. And when they say burnt out, it's usually associated with some kind of physical experience. Whether it's weight.
Yeah. So Karen,
What I did to fix my, no, go ahead.
Okay, what you can do, share a little bit about, because you were in the hospital, you know, and you kind of shared about the levels of structure, you know, and how it is laid out back in the day when you were there.
As far as the, like with the director and the management and all the other staff in between, then there was nurses. So we didn't always have a say, really, and I think we felt left out a lot, and left out to the point where it didn't seem like a lot of people cared about us, especially if we had to work short, if we were forced to work short. And then, so you just build a lot of animosity. So aside from just the regular patient stuff, there's also the conflict between the upper level staff. Maybe there's conflict between physicians. Maybe where, you know, you get a little bitter about whoever's calling in sick. There's it builds this toxic work environment, which makes the patient care even that much more challenging, because it's not a healthy environment at all, especially when you're run so short-handed. You don't get your lunches. We're clocking out to get paid for our lunches. You're having to be called back in and get up and go back and work a full shift. So there's so many different factors involved that people don't realize.
Yeah. Yeah, I guess if you're a nurse watching this, you probably know a lot about this already. If you're suffering physically, or you have illnesses, or you got some emotional stuff going on, or traumas, we can help you. I mean, Karen's been there, and you can learn to do this yourself. And when Karen first started this, I mean, she had the nurse mindset, and I said, listen, that mindset doesn't fit here. This is a different world. And it will help you to help yourself, and also create a system that actually does help people. So, Karen, won't you share a little bit about when we first started, you can change yourself, level 1, and start working up, and then the stress about helping people.
Oh, in this aspect of things, like sessions and everything?
Yeah.
Well, obviously I got into eutaptics initially to help myself. And as I was going through becoming a practitioner, I was hesitant. I remember having to have sessions about it, because in nursing, I felt so responsible for the patient. And you had to be on alert constantly. You had to pay attention to everything. But when it comes to doing a session with eutaptics, you're being the facilitator. You're helping the client. You're basically guiding them. And that the story that they're telling you isn't real now. Sure, it happened, but it's not real now. And whatever they tell you, as small as it could be or as large as it could be, you're not judging them. So it was dividing the two and realizing how different they were. Me working at the bedside or sedating a patient for a heavy duty procedure versus this. Your mind just switches in a different manner. I don't know if that answers your questions, or if it exactly where we wanted to go with that, but there's no pressure doing this like there was in nursing. You're making such a huge change. You can see the changes. One session you can see changes. And then they might be subtle changes. And then, like myself, all of a sudden it's like, wow, I don't do that anymore. I don't think that way anymore. I feel better. I don't have that pain. It's gone. It's just, it's so different than anything I've ever experienced.
It's rewarding, apparently, isn't it?
Yeah, it's very rewarding, because you always leave the client in a feeling good state, no matter what takes place in the session. And they always, even if I'm the practitioner, and you don't even, like, when the client expresses afterwards, you think, wow, that really made a huge big impact on them this session. You don't even realize until the end, and it's like then 2 hours just fly by. Mm-hmm. Yeah, and do people come up and have a lot of stuff? Yes, but we don't need to know the story. That's the gift in this type of work. We need to know the title, we need to know the emotions, the sensations, the feelings, and we can go from there. We don't have to sit down and listen to what happened.
Mm-hmm. So how did you get started? I mean, here it is, you found eutaptics. Tell us how miserable you were before you found it. Tell us what your friends said about you.
If I back up a little bit, as far as when leaving nursing, leaving the hospital.
Oh, that's right.
I didn't leave the hospital because I didn't care. I left the hospital because I cared too much. That's not really a fault, but for me, it was not. It wasn't a good thing as far as my health went. So I'm at the hospital, And I'd been building up and trying to move towards, maybe an early retirement, look for a different profession. And I was pushing a gurney down a hallway with a patient on it, bringing them to the recovery room. And I thought to myself, if I don't leave here soon, I'm going to end up to be that patient on the gurney. And I would have been. I mean, I've dealt with tons of different ailments, mostly pain, but a lot of things that people aren't aware of. I'd always been looking for ways that I could improve my life, my quality of life. I was always searching for ways to make my mind positive, and I would read a lot of people that we're familiar with. I went to see a lot of people in Hawaii live, Wayne Dyer, Deepak Chopra, Dalai Lama. Oh, I could probably list a half a dozen other ones. But as far as what I tried, aside from medical doctors, I mean, I went to medical doctors to the point where, especially when I was having pain and I couldn't roll over in bed at night, I couldn't wait to get out of bed and take a hot shower. But the doctor finally just went, I'm sorry, I don't know what's going on with you. Eventually, I saw somebody after that that diagnosed me with what's called myofascial pain dysfunction. Myofascial pain dysfunction. And that's just basically your whole body hurts because you're so stressed. Hip injury, which created a long-term problem, steroid injections, medications, massage, chiropractor, osteopath, acupuncture, all amazing, all very helpful, but nothing was as helpful as learning how to look after memories and things that haunted me from my past. So what I did is I had just before I left the hospital, I entered into an integrative nurse coach program, which I thought was amazing and taught you a lot of self-care and so on and so forth. And while I was doing that, as you know, I had a conversation with Gary, and I was complaining about the hospital, about this, about the relationship I was in, and he said, have you heard of eutaptics? So it couldn't have come at a better time, not only to help myself, but also to give me a niche to use in the integrative nurse coach. Everybody's always talking about you need a specialty. The nice thing about eutaptics, it's a specialty that you can specialize in certain areas, but otherwise you can cover everything, not just nurses with burnout. You can cover anything, any symptom, any problem, any issue. Can be small, can be large, can be a belief,
You mentioned that you were able to tell the difference with someone who was going to make it and someone who wasn't going to make it. And you were talking about the diagnosis and all that stuff. Can you go into that?
Yes, I would see two people, they could have the exact same diagnoses. Or a patient could come in and they're going to be getting a biopsy, and I could tell just by their personality, oh, this isn't going to go over well. But getting back to the two patients with the same diagnoses, attitude, positive, negative, belief. If they believed that they were going to get well, they would get well, regardless. They could be going through an experimental chemotherapy that they didn't even know if they were actually getting the drug. So I could tell, and I found that a lot of the patients that did do well, not to mean ignorant in a rude way, but maybe there was a language barrier, maybe the culture they were in, but they would always seem to do better because they knew less of what the results could be. Like, so they weren't not really educated. That's not what I mean. It's just maybe they didn't have a desire to look it up in encyclopedia at the time or whatever we had. Now we have the internet. So yeah, I could tell, I could recognize that who was going to do well and who wasn't.
So what I'm hearing is that, because when we work with people, and you've learned this in training about how we call it the universal pattern of creation and or belief, It's what you do in your head, and whatever you do in your head, you're going to manifest. So that's some of the worst things about getting a medication. They're going to read you all this negative side effects. And then, of course, as you're reading it and you're making up stories about it inside your head, then that person most likely will not survive very well, or have the worst outcome. And of course, one of the most powerful forms of that proves the power of the mind, which is every research has, is called the placebo effect. Now, of course, when we hear placebo, we think fake, but it's not fake. It's actually measurable. So what is a placebo effect? Now, my definition of placebo is the mind's great ability to heal itself in spite of the fake operation or the fake drug. And what is the mind doing? It's what it's processing, how it focuses, what it looks at, what it imagines, what it rehearses. And then, of course, the nocebo effect, it doesn't matter how good the drug is, no matter how good the surgery will be, the mindset of the client will make sure it won't be good. So it has a lot to do with the emotional mind-body connection. And so that's how the brain works. And of course, I've learned the mechanics of the mind, and I've had people come in with incurable illnesses, and I don't know about the incurable. I just, like Paul comes in, he's in his 70s, I think, or 60s or whatever it was. And he had 13 angiograms where they went through his groin and put stents in the back of his head. And he has nerve damage, real nerve damage, and they give him morphine patches to help regulate the pain. So he comes in my office, and I'm just saying, well, what happened, where it all began, give me the emotional scenario, give me the life events. And of course, at the time when all this was happening, he was pissed off, he's angry, going through divorce, he hated this, he hated that, everything was huge. And of course, he's still on medications. When he came in, I worked on those memories. I changed adjusted the memories. I changed the anger and the hatred towards himself and towards his wife and towards the doctors and towards his body. And all these things I just cleaned up where you can't. Now, guys, if you listen to me when I say clean up, memories are not stuck, real, and permanent. They're malleable. They're adjustable. You can take a memory and make it worse, and most of you have, or you can take a memory and make it good. That's a skill. So when we say adjust the memories, our bodies follow the mind's lead. The memories speak through the body. So when you go and change the memories, the memory in your mind is changed. Now remember, you can't change the past. You cannot change what happened. It's gone. And if you change memories in your mind, you're not changing the past. You're changing what your brain recycles on you. So when you update your memories, you're not changing the past. You're only changing how you internalize the past. And whatever you hold inside yourself, you're going to get more of. So that's what we say, adjust the memories, change it where it's positive. Now, some people say, you're lying to yourself. Well, let me be honest with you. If you're holding on to a past experience that's 50 years old, 20 years old, or 5 weeks old, that's a lie today. It's called emotional stupidity. Sometimes I call it emotional suicide. You're tormenting yourself with something that's over with, So we go and we adjust Paul's memories. We adjust it. And so he walked out, no pain. And then I went off his 3 months, 6 months. He came back later to see me, and he had this big stack of papers, and said, look, I'm supposed to have nerve damage. It's gone. The doctor said nerve damage the rest of his life is gone. All right, where did it go? He asked. I said, the doctor's got it now. Just kidding. It's just but again, it's all in the brain. Now, the science has proven the brain has an amazing ability to heal itself. Now, if you listen to me on this call, all you have to do is think of a positive experience and remember it as if you're there. You feel it. You can do the same thing with a bad memory, and it feels it. If you have a lifetime, now I work with a lot of people who've had complex PTSD. Now, of course, I don't believe in the D part, but a lot of complex emotional trainings. Lots of traumas in their past, and their health and their body represents that today. The woman who's walking around with her butt tucked under, and she came in for a session. I go, what happened? She said, my dad kicked me in the bum. So her brain tucked her bum under so she wouldn't get kicked again. It changed her physiology because for a fear. This is how the brain works. And science has proven, people who have diagnoses of cancer. You can back it up within 2 years. Prior to that, they've had some major emotional trauma, divorce, death, unwanted moves, unwanted changes, all kinds of stuff. So it's no mystery that the mind affects the body. It's no mystery. It's a fact. But knowing how to adjust the mystery, adjust the real cause. The real cause of problems is memory, and how you perceive it, how you process it, and how you work through it. And that's why a lot of these therapies out there, you go to a therapy and they can't change the number one cause of all your problems, which is memory. I suggest looking for one that does. That's the cause.
I just want to add with what you were just saying, one pet peeve I have is when a physician tells the patient they have so long to live. And another one that came up for me was pretty much all the patients that are in the hospital are there because their body followed their mind. So it's not just us nurses that are, it's the same concept. It's with everybody. And I would see that. And you could, and also too, what keeps people sick? They want to be in that state, but it's keeping them safe.
Mm-hmm. Yeah. And that's a question I hear a lot. So who will I be if I let this go? You know, when we deal with a lot of physical illnesses. A person who is really physically ill, emotionally ill with all kinds of stuff, they practice and rehearse what they don't want. They imagine worse scenarios. They build their day around being sick. You know, so it is a wild rodeo for sure.
Mm-hmm.
I know Phyllis McDonald, she was crying. She watched one of my videos. She called her husband. Robert said, I'm doing it to me. And it's not like you're really intentionally doing it to you. Your brain is doing it to keep you safe. And he said, well, maybe just listen to him. Maybe he knows what he's talking about, because I have a great history of helping people change their bodies. So, but yeah, so the mind does impact the body. Now, again, if you go to systems and they don't know how to deal with the real number one cause of all your problems, which is memory, you're just going to be swatting flies in the dark, and hopefully you find something, you know. And that doesn't, now let me just say this too. There are therapies. I mean, nurses are great. Doctors, I go to nurses, I go to doctors. I would not ever not go, because I need to when I need to. There are good people in every industry. But the most important thing is you be your own physician. I mean, you be your own healer. Now, would you do that? You invest in your health. How do you invest in your health? You invest in knowing how to use your mind in a positive way. Put good food in your mouth. Find good friends. Clean up your judgments and hatreds about your past. You know, that's your physician. That's how you're going to heal yourself. You know, let your medicine be your food be your medicine. Also, let your thoughts be your healer.
Yes, I recall a patient that I had in the ICU in Hawaii, and the body it has the amazing ability to heal itself. And I think that we don't give it enough credit, and I'll get back to the patient story. I think that we rely on others too much. We don't rely on ourselves. We don't take responsibility for our own peace and our own happiness. We want to take that magic pill or get somebody else to do it for us. But regardless, this patient did end up in the ICU, but he had the most supportive family. He was from a southern Pacific island, and it was real prominently known there, and so on and so forth. But I swear, in a 12-hour shift, we must have shocked him, meaning he was in cardiac arrest, so we had to use a defibrillator on him at least 16 times, I swear. I remember counting. And we were trying to convince the family, okay, you might want to just let him go. You know, this has happened. We couldn't guarantee how he was going to be neurologically. And months in and off the ventilator, you know, discharged from the ICU on the telemetry floor, back to the ICU, months. And then I was standing at the nurse's station one day, and this gentleman that I didn't recognize walked in, but he recognized me. And it was like, wow. How do you not have, he was coming to get his dialysis catheter taken out, didn't have renal, his heart function was back to normal, he didn't have, his renal function was back to normal. And I think the majority of it was his mindset that he didn't give up, the supportive family and friends mindset. So there's always that too, yeah. So I was taking the integrative nurse coach program, and probably 2 months into it, I learned about eutaptics. I had sessions from one of your upper level practitioners, saw a huge improvement. I was in a relationship at the time, and I remember being told, well, they're your best healer, so don't necessarily leave there. Don't run again, Karen, right? And the more sessions I had, the more value I saw in it. And in comparison to anything else that I'd ever tried in the past, I recognized right away. So I did level 1, and I did level 2, and I'm certified level 3, and I'm in level 4 currently. But yeah.
So what is it about the training that's good that you like? What was it?
I saw results. It's the long-term results, the fast results. For me, it was the only thing that really worked. Long-term, it's just being in the system itself. The value of being able to work on myself. If I'm a massage therapist, I can't work on myself. If I'm a psychologist, I can't do a therapy on myself. If I have a broken arm, I can't fix it myself. So this teaches you how to work on yourself and do the work, because if I didn't do the work, I couldn't be the practitioner I am today, because their stuff would bother me too much. Mm-hmm. That's just how the system is. You need to become the person to be able to provide that service to that other person. And you need to have the skills and the know-how, but you also need to be in the right set of mindset. You need to be in the upper model of the world. You need to be content in your own life. You need to how to work through. We're never going to get away from challenges in our life. Something's going to happen every day. You need that tool to be able to get you through your struggles. There's no way of getting around things just happening. So
yeah. So basically, what I see is that I'm giving you a philosophy of life, how you see the world. We're showing you how to actually like yourself and be your own healer in a sense. This is something that you'll use the rest of your life because it works, gives you control, gives you personal power, gives you value. And as you do that, you'll also be a good representation of how to live your life for other people, you know. I think for me, the most important thing is, you know, how many times I've seen this. Well, I have this great technique. It really helps everybody else, but it doesn't help me. You know, I've heard this so many times. I can work on other people. I don't know how to fix me. I said, well, you're missing something, and that's the reason why in level 1 you can change yourself. Of course, everybody should take this course because you'll learn the mechanics of your mind. You're going to learn how you can change you. And not only that, you're going to find a community of people who are in the same boat. They too know that you're not broken, you're not screwed up, you had some experiences, and we can make peace with those and change those, you know. So.
Yes, and it's not the first system program that I tried either, so it wasn't like I was unfamiliar with the attempts of improving my mindset, looking after myself physically, eating well. Like, I was exhausting. When you can't roll over in bed at night, you kind of get pretty desperate because of pain.
Karen, can you go into the physical symptoms you were experiencing? Because, I mean, you had nearly 40 years of experience as a nurse. What kind of physical symptoms? How did it leave you?
Yeah, how sick were you?
Yeah.
The physical, how sick was I? Well, probably a lot more than a lot of people that even knew me. was aware of, but I think I saw it happening in the beginning of my career with headaches, migraines. I recall not being able to wear my stethoscope around my neck because my neck would bother me. And not only that, but any older ailments that would start hurting, like physical, whether or not I fell off a step ladder, I hurt my leg doing this. So you have to factor in any physical accidents you've had as well, because when you're in a stressed environment like that, the pain just shows up. And a lot of people don't realize that it's from stress. So let's say headaches. Tension headaches, every headache known to man. I had ocular migraines. I remember being at work, I'd have to put one hand over my eye because I couldn't see the chart in front of me. You couldn't stop working and walk away. I had serous retinopathy that was just diagnosed a few years ago, and I went back just last week to check up on it, and it's completely gone. And because I don't have that stress anymore and I have this tool to work with. Sleep disorder, irregular heartbeat, back, hip. I'd say mostly chronic pain. I think probably the issue that I'm having remembering a lot of it is because I've looked after it, so it's not right there at the surface.
So you're saying
I
cleaned
tried.
up a lot of that. You're saying that you.
Yes.
Mm-hmm. Yep.
Yes, and then there's the apex syndrome, right, Robert?
Yeah. Most of you may not know. And that's one of the things I tell the guys who start the training. Take a picture of you now. Notice what you look like. Jot down how bad your life really is now. All the issues, all the pains, and all everything. Because as you move through the training, all those are going to disappear. And it's almost like, was that really me? Because it doesn't seem like you anymore because you've updated yourself so many times and your things didn't seem real anymore. Because they're not. Neurologically, they've been updated inside your brain. So yeah. So but that's another thing too. We talk about students. You got to keep your success journal handy because your life today is normal. But if you look back 10 years ago, this life you live would be an impossible dream. But it's just kind of because you've been updating yourself and improving the quality of your internal world. So yeah.
Mm-hmm.
If you're a nurse carrying years of emotional stress and trauma that's showing up as chronic pain, tension, migraines, the things that Karen are talking about, book a private one-on-one session with Robert, with Karen. They can help you release decades of the trauma that you experienced and restore your body back.
Yeah. Another thing, guys, if you like what we're talking about here, sign up, ring the bell, subscribe. If you have somebody suffering, if you have somebody suffering who wants help, send them a link. We got all these podcasts, we got trainings, free trainings. Everybody needs a better quality of life. And the only way to do that is figure out how it works. And that is how to change yourself, improve the quality of yourself. So sign up, subscribe, book a session with the practitioners, and we'll help you change your life. I know for some of you it's a scary journey because of all the stuff you have inside. Be honest with you, it's just stuff. I know it feels real, but once you start adjusting it, it's no longer real and you have a new outlook on life. It's an investment in time, heart, and effort, but it will pay off in a big, big way. So just come join us. It will change your life for sure. It's changed Karen's life. After you start doing the addressing memories and adjusting your traumas, how's your body now?
Oh, I was talking with Crystal about that the other day. I don't like rarely. What I do notice is if I get stressed, I have this one spot in my back that will hurt. So what does that tell you? It's coming from here.
Yeah.
But it's so minor. It's like I couldn't live with the pain I was living with before. I don't know how I lived with the pain I was living with before. And people that have pain can relate. And when they say it's all in your head, now I know it kind of is all in your head when it comes to the stuff that you're dealing with. But as far as me being a different person, Physically, mentally, emotionally, non-judgmental, not as judgmental. I mean, we're always going to judge a little bit here and there, but your habits change. You don't walk around complaining all the time. I notice things in other people, their programs, their patterns, let them off the hook because of that. Recognize when things they're doing is just keeping them safe. It's like people really don't know any better. It's their subconscious, like Robert could elaborate on. Logically, we want to do something, but we can't because our subconscious doesn't know the difference between good and bad, and it's really just keeping us safe and keeping us trapped.
Definitely. Karen, are there any things that you would want to share with our listener? Anything that you would want them to know?
Don't wait to start looking after yourself. Too many of us focus on what we don't want, and we don't focus on what we do want. And I really think that needs to outweigh what you do want. Start that. Just attitude it is easy if you really put a little effort in it. Because for me, it takes a lot less energy to feel good than it does to feel bad. And I think a lot of people don't realize that. So don't wait. Just, even if you're feeling good, then especially don't wait. That's probably the best time to look into it. I think this being proactive and taking this step towards getting involved with something like eutaptics.
That's right. And we'll have the link for level 1, You Can Change Yourself, in the show notes. So go ahead and check that out.
And Karen, the other day you talked to Gary again after a while, and you said you were talking about it. And you said, "Well, what did y'all talk about?" I know you shared a little bit earlier.
I was mentioning how I didn't really look after a lot of my hospital memories initially. What I mean by look after them, change my perception of them and everything so they'd stop haunting me without me knowing. And I was saying how you were always encouraging me to do this and to look after those because you weren't letting me off the hook for it. And he said something like, "Oh yeah, you were complaining about the hospital, you were complaining about your relationship, you were complaining about this, you were complaining about that." I'm like, "Oh yeah, I forgot about that." I forgot how much complaining I was doing back then, 3.5 years ago or so.
Yeah.
And I'm really grateful for him for introducing me to this specialty.
Yeah. Yeah, it's you're very lucky, to be honest with you. I mean, most people don't realize that life can change. Your world can change. Most people don't realize that, Of course, when you go and you try all these different therapies, and if the therapy, I'll say this is how you know if it's a good therapy. First of all, it gives you the keys to change yourself. It's not pointing to your past. It's not pointing to your DNA. It's not pointing to some past life experience. It's pointing to how you internally represent yourself. It's showing you how to change yourself from within yourself, changing memories. And you can do it, and you don't need them to do it for you. So we want something that's self-empowering. Now, granted, you can come to me and I'll show you how. You need to know how. But you need to be able to fix yourself and solve your own problems with good skill, knowledge, and understandings. And I know for some of you guys, I know it's scary. Those of you who are listening, I know it's scary. You tried everything. And I know that everyone, a lot of people say, "Well, I'm the worst one that you've ever met." And I said, "Trust me, I've worked with worse." It's like, when I've done it for 26 years, I'm working in drug rehabs. Drug rehabs is the mecca for emotional craziness and abuses and traumas and you name it. And we go and we clean it up, So if you're ready for a better life, we can help you. It's a journey. And, check us out, check our stuff. We got tons of testimonials from all across the world, from every economic situation in people's lives, from rich to poor to common to uncommon. And like we've done it all, the worst physical abuses, the worst sexual abuses, the worst traumas, war memories, you name it. We've done it all. So, and you can be helped. And I think that's a nice thing about my system. Now, Karen, she can choose a niche, such as nursing, helping nurses. But even when you help nurses, nurses will bring their life with them. And some of their lives have some pretty dirty, crazy stuff in their childhood too. You know, I can choose addiction. I have to know how to deal with physical abuse, physical traumas, emotional traumas, sexual traumas. If you want to lose weight, it's all there because the brain is a metaphoric machine. So weight loss we could do, addictions we can do, traumas we can do. If you have some area of your life you want to help become better, you can improve your relationships by changing you. It's all about you. So.
Do you have any closing remarks, Robert, for our listeners?
Well, if I'd say anything, guys, those of you who are listening to me, isn't it time to get off the couch? Isn't it time to do something different? You tried all the other things. Now this will actually work. I'll assure you it will. And learn to be your own best friend. Learn to be your own healer. Learn how to take control of your inner world. As you take control, and I'm not saying controlling of the inner world, be the master of it. We're not tucking away. We're not hiding it. We're adjusting it to where you have something better. And as you do that, your health will get better. Relationships will get better. Your finances will get better. You'll be a better model for your kids or your grandkids or whoever's in your life. You only have one life. It's not meant for suffering. It's meant for living. And we're here to help you. You deserve something better. Now, it will take some effort, and I know it's scary, but just remember, we're here for you, and you can do it. We believe in you because we know. Karen's been there. I've been there. Crystal, she's still going through there, aren't you, Crystal?
Stop it. I'm the worst one of them all.
You're not the worst one, but you're still just only level 2. You're just working through this stuff.
Yes. Well, it's interesting because I thought I worked through so many of these things, but when I got in the program and we actually started adjusting the memories, actually adjusting, because I've been in other energy healing modalities, all of a sudden memories started surfacing that I didn't even know I had. They came to the surface, and now my life is changing.
Yeah.
Like, this is real. This is the real deal, and I will talk about that forever.
Yeah, we're all going through it. You know, I still work on stuff. I still have stuff show up. You know, not as big as it used to be. It comes in different angles for different people, different places.
Well, I do. I have a question around that. Because people talk about healing as being like a spiral. So you're healing at this level, and then you get to another level higher up, and you have a different angle of looking at it. Is that how you see it too?
We'll still the word healing out. How about educating and updating? Yeah,
Okay.
that's all we're not sick.
True.
We're not sick, right?
I know. I know.
So when you start to transform your inner world, because there's what you call layers of stuff that you had before, and now they're not there, but there's a next layer that you need to see. The brain is so big as far as memory wise, and it captures so many different angles that we consciously are not aware of. And so as you move through your head and your world, the thing that doesn't change is your external world. So your external world hasn't changed. And the thing is, your external world will stimulate you, educate you, and you have to figure out how to maneuver through it. Right? There could be some bad players that show up in your life, and because you picked them or allowed them. And then you have to look at it and say, okay, what's mine, what's theirs, and how must I overcome this and not allow it to happen again? So I think that's the deal. You're continuously learning. You're always learning and improving. And if you don't learn in a positive direction, you'll learn in the negative direction. That means your problems will compound over the years. Just like with Karen's, over the years of accumulation, all the memories and experiences she didn't know how to handle started working through her body and working through her mind, being scared and illnesses and all that stuff, because it accumulates that way. So now the negative, seemingly negative accumulation, now we're dismantling it. And then as we move through life, we'll still be dealing with new people, new opportunities, and new angles. So it's just it's a continual growth. The thing is, I can do it. Before I started, I was helpless. I couldn't do anything but suffer and endure. So there's a big difference.
Yeah, big difference. All right. Well, thank you for joining us on another episode of the Robert Jean Experience. Check out the show notes for the links, and remember to subscribe and share this podcast with a friend.
Good job. See you guys. Thank you so much. Peace.
Yeah, peace. I would never go
Right.
back. Once you go to eutaptics, you never go back.
I know. I was thinking about that. I wanted to also, like you saw, make the point about how I did not just stumble onto this. I had already previously tried numerous other things.
After you start doing the addressing memories and adjusting your traumas, how's your body now?
I don't like, rarely. What I do notice is if I get stressed, I have this one spot in my back that will hurt. So what does that tell you? It's coming from here.
Yeah.
But it's so minor. It's like I couldn't live with the pain I was living with before. I don't know how I lived with the pain I was living with before. And people that have pain can relate. And when they say it's all in your head, now I know it kind of is all in your head when it comes to the stuff that you're dealing with. But as far as me being a different person, physically, mentally, emotionally, non-judgmental, not as judgmental. I mean, we're always going to judge a little bit here and there, but your habits change. You don't walk around complaining all the time. I notice things in other people, their programs, their patterns, let them off the hook because of that. Recognize when things they're doing is just keeping them safe. It's like people really don't know any better. It's their subconscious, like Robert could elaborate on. Logically, we want to do something, but we can't because our subconscious doesn't know the difference between good and bad, and it's really just keeping us safe and keeping us trapped.